We are entering the time of year that typically marks the start of cold and flu season. Research shows that getting the flu vaccine can reduce influenza illnesses by 40 to 60%. And if you get the vaccine sooner, you can help us avoid a strain on our health system. Let's learn more from one of our talented Intermountain Health physicians.
Hi, I'm Dr. Elizabeth Bisker, family medicine physician and Chief Medical Officer for Intermountain Health Medical Group Western Colorado, and I'm honored to be able to join you today. Let's talk about some of the most common questions about the flu vaccine and answers for you to consider. We always recommend discussing what's best for you and your health with your primary care physician. Most people do need to get the vaccine every year because the flu virus is constantly changing. Flu vaccines include inactive strains of the viruses that are predicted to circulate each flu season. Yeah, so the flu shot does wear off in about 6 months and does not provide long-term protection, which is another reason that we have to get one every year. We typically suggest getting the flu shot in early fall, before the end of October, because it takes about 2 weeks to be fully protected after you receive your vaccine. It's hard to predict when influenza will peak this year, nor do we know what impact COVID-19 will have on influenza trends. Nevertheless, getting the vaccine to prevent the flu is vital. Predicting what this year's flu season will look like is difficult. Despite new COVID-19 vaccine boosters that may be coming out soon, the virus that causes COVID-19 is currently circulating in our community, and future waves could put a strain on our healthcare system. We don't know what the next few months will hold, and if we have a significant COVID-19 resurgence that's putting strain on our healthcare system, it may become overwhelmed, and access for the general population to appointments for flu and other illnesses might be diminished. So if it makes sense for you to get your flu shot now, get it as soon as possible. Yes, studies have found that it's safe and effective to get both your flu shot and COVID-19 vaccine at the same time. Because the two vaccines are for two different viruses, your body can still mount a proper immune response to both. And if you typically experience side effects after receiving a flu shot or have had side effects after receiving an earlier dose of COVID-19 vaccine, you may experience similar side effects after receiving them both at the same time. Yes, it's true that the flu vaccine won't work in everyone who gets vaccinated. A person's immune history impacts their response to the flu vaccine, as well as the effectiveness of the vaccine varies from year to year. However, even when the vaccine isn't as effective, it can help minimize how sick people become if they do get infected.